Brain is the most complicated organ. So operating the brains, how did you come and how did you choose such a career?
My dad's a neurosurgeon. Right from my school days, on the weekends, I used to go with him to the operating theatre and he used to show me stuff. Very early on in my career, I knew I wanted to do neurosurgery just by the sheer exposure of it.
There was a guy who's being operated. The surgeons are obviously behind him, brain is being opened. And this guy is sitting and playing the violin. How is that possible?
You have to understand that the brain per se feels no pain.
Oh.
So it's very easy. If I open your head and tuck on it, it's not going to feel anything. It's only the structures around the brain that feel stuff. India is the head injury capital of the world. 1 death every minute.
So this is like in all over India, 1 death every minute. This is the statistic of road traffic accidents happening. You know, Elon Musk has come out with Neuralink. It is dangerous.
The danger is only people are talking about it is whether are you going to misuse it to become smarter, to become more intelligent, to enhance your performance in whatever field you're trying to excel in.
But what if we are headed to a really man versus machine war? What if Terminator was true?
I mean, eventually it will become that way, na? You have to be wise enough to make it your slave rather than your master.
Have you come across patients who, not doing astral projection, but come across patients who have experienced this?
There was a neurosurgeon who sustained a fulminant infection and his soul left his body. He traveled to some place far away, but he could see and hear every single thing that was happening to him in the ICU for 21 odd days. And when he came back, he regained consciousness. He wrote a book about it. It's called The Proof of Heaven, and he was able to narrate every single conversation that people had at his bedside, all the fun they made about him, all the hope that was given up. So 100% there is some stuff.
Does meditation improve cerebral function?
Rishi Munis are definitely at a higher plane than me and you because they did all of this stuff, and now we have enough evidence, scientific evidence.
How much of the brain has actually man understood? Hello everyone and welcome to one more episode of DTalks with Dr. Kapil. आज हमारे जो स्टूडियो में है बहुत ही स्पेशल गेस्ट आए हुए हैं. हाउ डू आई डिस्क्राइब हिम यार? ये न्यूरोसर्जन भी है. He has got weekly columns in the newspaper. You know, the way he connects with his patients and with, people all over the city. It's absolutely brilliant to witness. For all you Grey's Anatomy fans, you know about McDreamy. So this doctor is the McDreamy of Mumbai. None other than Dr. Mazda Turel. It's a privilege for me to have him on the studio. Believe me, this is going to be a roller coaster episode. We're going to discuss so many aspects about one of the most complex organs of the body, which is the brain, nerves, and the spinal cord. So please keep watching. ये आप देखते रहिए. इसमें बहुत कुछ सीखने मिलेगा. And it's a thrill to have Dr. Mazda Turel here. Let's watch this podcast. Hello and welcome to DTalks with Dr. Kapil. Dr. Mazda, I'm so happy कि यार आप यहाँ पे आए really because I know you are a very, very, very busy, surgeon. Not only are you a neurosurgeon, आप तो एक columnist भी हो. How do you manage this यार? दोनों कैसे आप कर पाते हो?
Abhi, it took me 2 hours to come from work to this place. I wrote one article on the way.
Arey wah, I was about to thank you because this is like the other side of town for you.
Gosh,
so thank you so much.
It's not even in town.
I know we had that joke, but I would like to thank my mom actually. My mom is a big fan of your columns, and she was the one who told me कि यार Kapil, please एक podcast आप Dr. Mazda के साथ कर लो. So thanks to her actually, I contacted you.
Thank you so much. My best wishes to her, and thank you very much, Mummy, for reading wherever you are.
Sir, मुझे बस पूछना था. I'll just start off this podcast by asking you, why neurosurgery? Of all the things, brain is the most complicated organ. ये हम सब जानते. Even for non-medicals यही है. But, not only are you a neurophysician, you're like a neurosurgeon. So operating the brains, how did you come and how did you choose such a career?
I think it's the most fascinating field of surgery. The brain is the function of the body is to carry the brain around. So every other organ, while all other specialists might say are important,
I got that.
especially your pulmonology friends. But there's nothing that compares to
मैंने
the
गलती
brain.
कर दिया सर को कि मेरा प्रोफेशन बता के, but ठीक है, not an issue.
There's nothing that compares to the brain, however hard you try. Having said that, every single organ has its own importance, but the brain, coming to think of it, has about 2-3 billion neurons. I don't know who counted them, but there are 2-3 billion neurons in the brain. They communicate with one another to form a couple of trillion synapses. And it is from this whole interaction is where our consciousness arises from. It is what makes us who we are. It is what makes us so different. Even though structurally brains all more or less look the same.
The same, yeah.
But the activity that goes on in the brain is phenomenal. And so there's nothing that really can compare to the functional capacity of the brain. You know, you've heard this famous thing that people say that we use only 10% of our brain.
Yeah. Is that true? But
I'm quite sure you've met people who use much less than that also.
I
But
hope
nobody
I'm not one
knows,
of
no.
them. I hope I'm not one of them.
No,
but
nobody knows. Nobody knows these things. You know, everybody is full of postulating stuff, but we still really don't know what the capacity of the brain is. It's
think-
just phenomenal.
I think obviously your passion for neurosurgery is coming along, with this answer कि क्यों आप इतना passionately आप एक neurosurgeon बने. But let me probably take you back to, let's say, your MBBS days or your PG days or something. When was the first time that you probably in an OT saw someone opening the brain and you actually saw the brain, all the structures and everything? When was this?
Actually, my dad's a neurosurgeon.
Oh,
So
okay.
right from my school days, on the weekends, I used to go with him to the operating theatre and he used to show me stuff.
Wow. So
So
since school days.
It was
wow.
fascinating, yeah. So since school, very early on in my career, I knew I wanted to do neurosurgery just by the sheer exposure of it.
Got it.
So
Got
it
it.
was
So school, obviously this is not a routine, I mean, in school days, someone seeing the brain being operated is obviously,
Yeah.
it's just brilliant.
It was quite
Good that it shaped
fascinating.
you. Thank you so much, sir, ki aapke karan, Dr. Mazda has picked up this branch and helped so many patients. But, lovely to know that, there are neurosurgeons having their own podcast. This is known as Rebooting the Brain. I don't know if you've heard of it. It's a lovely title, by the way, Rebooting the Brain. Dr. Srinivasan and all. And they had a lovely reel which went viral, जहाँ पे वो लोग बोलते हैं कि medicine में you've got this phenomenon known as neurophobia. Medical students को neurology cases से नफरत है, phobia है. Why? Because it's too complicated. You, on the other hand, are completely opposite. From school days, you've had this influence, and today you are obviously a celebrity neurosurgeon.
hardly celebrity, but neurology actually forms the basis of your interest in neurosurgery. I really like neurology. And if you look at neurology, it's very straightforward.
Okay.
It's sometimes it can be complex, but it's a little bit like math. It's a little bit like just putting the pieces of a puzzle together. And that's what makes it so fascinating and
Sir,
so
I must
interesting to
ad-
be able to diagnose stuff correctly.
I think I must admit over here, a lot of medical students will probably not agree with this statement, that neurology is so, but I think you are so into it, probably
I
you've
think
got
it
a very
also-
different way of looking at it.
It also depends on who teaches you.
Yeah,
We
that's
had
true.
great
That's
teachers. We had great teachers who inspired us. We had great teachers who unfolded neurology to us in medical school. We had the likes of, Naushir Wadia and all those people coming when we were just in MBBS. So it was really great to look at these legendary guys talk about neurology with they're the ones who actually describe certain syndromes and diseases. So it's fascinating.
I 100% agree with it. I mean, that's the importance of, great teachers. You look at the passion which is coming along in this podcast. Sir, I was very, very surprised. There was a recent video in Google, and I want all of you also to Google this out. There was a guy who's being operated. The surgeons are obviously behind him. Brain is being opened. And this guy is sitting and playing the violin. How is that possible?
So, I mean, awake brain surgery has been done for 30 years, 40 years now.
Wow.
Yeah.
And
See,
how do you understand कौन सा patient में awake करना है, कौन सा?
Correct. So, you have to understand that the brain per se feels no pain.
Oh.
So, it's very easy. If I open your head and tuck on it, It's not going to
Please.
feel anything. It's only the structures around the brain that feel stuff. The
Okay.
skin, the bone, the
Okay.
covering of the brain, which is the dura. And all those you can numb with simple anesthesia.
Okay.
So, in fact, just before I came here, I did a procedure under local anesthesia, drilled a hole in someone's brain and removed some blood that was collecting. So, those procedures are done under local, but you can do brain tumor surgery under awake conditions. And that's primarily if a tumor is in the speech area. And you want to check speech function while you're operating because there's no other modality to check it.
So what do you mean by you want to check speech function? मतलब
If
आप
you-
surgery करते do you ask the patient to talk or
you
something?
ask them to say the whole life story. आपका
Wow.
जन्म कहाँ हुआ, आप कौन से स्कूल में गए, आप स्टॉक मार्केट में कितना पैसा बनाया, all those things you ask them
While you are operating.
while you're operating. And then you test certain functions of language, naming, reading, writing, repetition. They can even sit and write on an iPad for you. They can name, they can match the columns, they can do all of that. Now we have detailed programs on an iPad that allow you to do that while a patient is fully awake, while he is watching his own operation on a giant TV screen in front of him.
Wow.
So certain select conditions where
Okay.
tumors are in such areas where you want to get instant feedback. You do tumors that might be very close to hand and leg areas, close to the speech area, close to other areas of cognition. At that time, you choose the patient to be awake. Most of the times, we do cases under general anesthesia, but certain select conditions, we do them awake.
So it's brilliant, it just sounds like a completely different, zone completely. But I want everyone, please go on Google and, जैसे doctor साहब ने बोला, actually these surgeries being done, and obviously he's obviously very busy doing these surgeries. So neurosurgery is a very vast branch, obviously. Now I cannot incorporate a lot of this, but we've had a request to discuss certain things with you. So first, I just want to take up head trauma, if that's okay
Yes,
with you.
very
Now-
important. India is the head injury capital of the world.
Wow.
1 death every minute. More than that, maybe.
So this is like in all over India, 1 death every minute. This is the statistic of road traffic accidents happening right now. See, this is. Sir, head trauma, do you think this is a colloquial term which, lay people just say, or neurosurgically, how do you view head trauma?
I mean, it's a vast spectrum of diseases. You can get something as broadly, it's classified as a mild head injury, a moderate head injury, and a severe head injury. And then you have different kinds of head injuries. You can have a extradural hematoma, which is a collection of blood between the bone and the surface of the brain. You can have a subdural hematoma where blood collects below the covering of the brain but not in the brain. And you can have a parenchymal hemorrhage where there's bleeding within the brain.
So what is the meaning of this word dural? What do you mean by that?
Dura is the covering of the brain. Dura
Okay.
is the layer that protects the brain. That's the outer surface of the brain. And that covers the brain. And that helps the brain from, it's like, it's called dura mater. Mater in Latin means mother. Mother, how a mother protects a child, the dura mater protects the surface of the brain from any kind of insult, from tumors from infiltrating out, from infection from outside coming inside, from the brain brushing against the surface of the bone or the skull. So that's the protective nature of the dura. And if that gets breached, you can either have a subdural, or you can have, if it's between the bone and the dura, you can have an extradural. But they're all different kinds of hemorrhages that a head injury can present with, depending on. And then you can have severe head injuries where there's shearing force of the brain, where the whole brain rotates within itself when there's a sudden impact.
My God, is that possible? I mean, the entire brain rotating.
So the brain will rotate a couple of millimeters.
Wow.
And that's what causes something called as diffuse axonal injury, which is the worst kind of injury, where you may not see much on a scan, but the insult is very severe because it happens at a microcellular level. All the fibers get sheared in a certain way. And those are the patients who, they say are in a coma, or they find it difficult to get out of consciousness.
ये आपने जो term आपने use किया, diffuse axonal injury, जो
Yes.
I mean, have you ever come across such a patient? Because see, I'm just thinking from a relative's perspective.
Yes.
First of all, a trauma. Obviously, it's a very traumatic experience for the relatives. It's a microsecond probably misjudgment. You are having a head injury. You go to a hospital. There is a neurosurgeon who is over there. You've done all sort of scans. Everything is normal. But still the patient is not improving. So how do the relatives take it?
So technically, the scans won't be normal. If you do a MRI, it will show you the extent of injury. Even a CT scan will show you diffuse like insults that are there in the brain. It's not as catastrophic as you would see in a big hemorrhage or a big hematoma, but you'll see it.
Okay.
You need to have an eye for it.
Okay.
And sometimes those are the worst kind of injuries because there's no surgical treatment available and patients are on a ventilator for a long time.
Mm-hmm.
The improvement is slow and steady, sometimes not at all. Patients can remain in a persistently vegetative state for a long time. So again, it just depends on the kind of injury you've had, the damage that has happened at the time of injury and the secondary damage that happens after an insult like that.
Sir, आपने, in your answer you mentioned about dura, extradural, subdural, main brain का जो parenchyma जो है, brain matter में bleeding. ये जो 3 condition आपने जो बोला, what will be the difference in the patient's presentation to you?
So all of them can present with varying levels of decrease in consciousness.
Okay.
After a head injury. Mm-hmm. So the only way to identify it is with a CT scan.
Okay.
That's the only way to tell what is the exact nature of the injury. And then depending on what the scan shows and what the level of consciousness is, you decide whether you need to go in for surgery or you can hold on or you can wait or you give some medical management to reduce the swelling, or sometimes you may need to put in a drain to relieve the pressure in the brain. Okay. So all those different permutations and combinations is more technical, but that's how we go about deciding on how head injuries need to be managed.
I was in fact about to ask you this only, in what cases and how do you decide when to operate, but you've explained it beautifully. Before I go into the next segment, एक question मुझे पूछना था, sir, and a lot of patients, especially neurological cases, they always have this doubt, about when exactly a CT scan needs to be done, when exactly does an MRI need to be done. Now, you are a neurosurgeon, आपके पास सारे cases, you've got a gamut of cases, spectrum है. How do you know कि कौन से disease में क्या investigation करना चाहिए? And broadly, what is the difference between the two?
Yeah. So there are different modalities of imaging. Mm-hmm. A CT scan is a quicker, faster modality. It uses a little bit of radiation.
Okay.
And it shows you bone and blood very nicely.
Bone and blood, okay.
Compared to an MRI. An MRI takes a little longer and it shows you soft tissue very nicely and it shows you acute strokes very nicely. Mm-hmm. If you're talking about emergency procedures.
Got it.
Now, let's say if you have sudden onset severe headache, no head injury, you suspect something called as an aneurysmal subarachnoid hemorrhage. Mm-hmm. You do a CT scan. If you have a head injury, the first imaging modality will be a CT scan.
Got it.
If, let's say, you have a sudden onset stroke where you come into the emergency with a sudden onset paralysis or facial deviation or slurring of speech, which are symptoms of a stroke, then we would do an MRI. It might very early on pick up the area of an infarct, or what we technically call as reduced or loss of blood supply to a certain area of the brain.
Got it.
Now, let's say if you have headaches that are not going away, you have headache associated with vomiting, double vision. If you just have a dull aching headache that's not subsiding, you'd get an MRI done.
But because what duration do you get an MRI? The duration of headache?
I would recommend anybody to get a MRI done if their headache doesn't subside in 2 weeks.
2 weeks. Okay.
If they have a dull aching headache, if they've ruled out an eye problem, a sinus problem, a sleep apnea problem, a ear problem, a jaw disease, an impacted tooth, all of these can cause headaches. If that all is ruled out and headache still not going, you should get an MRI done, because I see umpteen number of people our age, all they have is a dull aching headache and they end up having a brain tumor.
Brain tumor, wow.
Brain tumor. That's the only thing you want to diagnose primarily.
Okay.
That's the only thing that's sinister. That's the only thing that's worrisome. That's the only thing that you want to quickly reverse if it's possible.
Okay.
So I have a very low threshold for getting an MRI done, because if you are able to pick up a tumor in somebody, you're able to give that person a lease of life.
Sir, in the beginning you mentioned statistics. Ki India is the accident capital of the world. It's almost like one death happening every minute.
Yeah.
Now, suppose there are onlookers.
The kind of construction that's going on.
It's going on. Yeah, I was about
maybe
to.
Every second.
I think in Mumbai the rate would, I think,
Yeah, it's
triplicate
horrible.
almost, yeah. But sir, I just wanted to ask you from an onlooker's perspective. If there is a head trauma, let's say happening in front of me, there's an accident in front of me, is there something known as like I need to get the patient as soon as possible to the hospital? Is there some sort of a time limit that you would give?
I mean, ideally, it depends on the severity of the impact and what has happened during the accident. If you say, let's say, two cars collide and someone's unconscious, then of course you have to get someone to the hospital. You have to make sure that you're not over enthusiastic in doing it because they may have a concomitant cervical spine injury. So it's very important that you don't just lift patients anyhow. You make sure that they're lying flat on something. You log roll them, as in turn them onto one side. You make sure that the neck is stabilized in some way.
The neck is very important.
Yeah,
Okay.
because if you have a 30% of patients who have a severe head injury or a massive big head trauma also have an associated cervical spine injury.
30% is a huge number.
30% is a huge number. So if you manipulate the cervical spine while trying to get them to the hospital, you might cause an additional problem. You can cause a paralysis. You can cause any kind of further damage which was not existing to begin with. So you have to be a little careful. You have to make sure you don't, try and splash water on their face or give them something to eat or drink just to check whether they're alive or okay. Don't do any of those silly things. Don't make them smell onions like which most people do.
Yeah, I've seen people doing that, especially if someone's
So
having an
just-
epileptic attack or something.
Yeah.
They quickly get an onion, to make sure that.
So just get them safely to a hospital and then let people take care, because it might be difficult. I mean, you want to check if they have a pulse. First, most important is, which they teach you in medical school, is airway, breathing, circulation. Is the patient able to take a couple of breaths? Is the pulse present? Is the circulation okay? All of those things.
Okay, so from an onlooker point of view, the three things which you think that they have to do, not what they not have to do, but what they have to do when they witness a road traffic accident, what will you say? 3 points.
First, check airway, breathing, circulation.
Okay,
Secondly, make sure the cervical spine is not manipulated.
okay.
And then assess the need to take them to a hospital, and then
These are the three
figure out a
things.
way in
Okay.
which they
Okay.
can get there.
Quick question about helmets. You've got these varying types of helmets, especially in head trauma. You've got a full covered helmet, and sometimes you've got these jazzy half helmet ones. Obviously, why is there such a thing known as a half helmet? I mean, as a neurosurgeon, I'm sure you will advocate for a full helmet.
Yeah. I don't know, man. I don't make the laws in this country, but something's better than nothing, right?
Okay.
At least if some part of you is protected. I think the bigger helmets are very claustrophobic, and some people, any part of the most sensitive part of your head is the temporal bone,
Okay.
which is the thinnest part. And
Okay.
if something's there to protect that, if you ram your face, you may have facial fractures, but you may not hit the brain as much. But if
Okay.
this part gets injured, there's a high chance that you may get what we discussed, an extradural hematoma or a subdural hematoma or any kind of other
Okay.
brain injury.
Okay. So now from head injury, I want to discuss about two terminologies. The first terminology is coma. Now, usually what happens is you go to any major hospital, you go outside the IC or something, you always see relatives and there is a gamut of emotions wahan pe. They are confused, they are afraid, they are frustrated, angry. There's a lot of emotions over there. Now, people react very differently to coma. There's a lot of varying sort of understanding. According to you, what is the meaning of coma?
Coma in a lay man's perspective is just a lack of awareness and a lack of responsiveness, if you were to put it.
Okay.
If
Lack
you
of
are
awareness and lack of
unaware
responsiveness. Okay.
And unresponsive, you could be termed as being in a coma.
Okay.
You know how after having a heavy meal, we are in a food coma. It's like that. You want to knock out completely.
Yeah, that's almost 16 hours for me in a day.
Is it? So that's the simple definition of coma.
Okay.
Now it can be structural, it can be metabolic. Sometimes you can be in a coma simply by having low blood sugar. If you have severe hypoglycemia, you can have a coma. You could be in a coma due to an infection in the brain, an encephalitis or a meningitis. You can be in a coma because of a head injury. You can be in a coma because of a structural problem in the brain. If there's a big brain tumor that has caused mass effect, midline shift, you can be unresponsive. You can be unaware. So that is a broad terminology
So now you've already enlisted so many causes of coma. So what obviously the message which I am getting is the response to coma obviously will depend on the cause. So
Exactly.
if suppose you've got low sugar, you mentioned the first low sugar. I think it should be the easiest. You know,
Correct.
just give a bit of sugar and
You have
that's
to
it.
identify it. Strangely enough, you're still not able to identify
it.
that coma is because of that. Especially diabetic patients can have episodes of hypoglycemia, and that is easily reversible instantly.
Got it.
But if you stay in a prolonged state of hypoglycemia, you're not identified, you can cause irreversible brain damage.
But so what are the 3 conditions which lead to coma, which according to you will take the maximum time?
So head injuries.
Head injuries, okay.
Number 1. If there's a fulminant infection, if let's say you've had a coma because of a very bad meningitis or an encephalitis,
Okay. So infection will be number 2.
an infection,
Okay.
then there are other, let's say you've sustained an insult, post-operative insult,
Okay.
because of which there is, a patient has had damage to certain structural damage to certain important areas of the brain, like the hypothalamus, the thalamus, the brainstem, or other cognitive area. The other cause of long-term damage for coma, if you would say, is patients who have a heart attack and who are resuscitated for long and they don't get enough oxygen to the brain. An entity called as hypoxic ischemic encephalopathy.
Okay.
So that itself can leave a patient in a persistently vegetative state for a very long time.
Sir, after a coma, suppose a patient is in a coma. I mean, it can be, let's say, 2 days, it can be 5 days, whatever. What time limit that you as a neurosurgeon will see after which you're like, okay, I think there is irreversible brain damage, or there is a cognitive dysfunction, or his memory will go?
Usually, I think it's different for different situations. But if you're not able to come out of it in 6 weeks,
6 weeks, okay.
for most part, I mean, you've heard these obscure stories where people wake up from a coma after 2 years, 10 years, 15 years. But that's like, those are freaky things.
Okay.
That's not the norm. But in 6 weeks, if you've not shown any signs of waking up, then it's unlikely that you will.
Okay. 6 weeks, okay, wow. So the second thing which I wanted to ask you, and this is more of a personal thing because I am more into organ transplantation and organ donation. It's about brain death. Now we've got this entity and sometimes people find it very difficult to understand brain death. So if you could explain what is brain death?
So it's a condition where the brain sustains an insult for whatever reason. It could be a head injury. It could be a stroke. It could be any kind of damage to the brain, an infection, in which the brain stem reflexes are absent. The pupils don't react to light.
Okay.
The pupils are what is termed as fixed and dilated. There are no additional reflexes such as the cough reflex or another reflex called as the corneal reflex. If your basic reflexes of the brain stem are absent on clinical testing, and if you are unable to trigger a breathing response, then technically, clinically, you're termed as being brain dead.
Brain dead, okay.
While the rest of the body is still functional. So the heart is still pumping blood and is fine, but the brain has shut down. And the possibility of any revival after this declaration of brain death is 0.
So obviously it's quite a serious thing, brain death. I mean, we see these movies, जैसे मुन्ना भाई MBBS में हमने देखा, a patient after brain death or, whatever. And in the end, you realize that he's the one who's narrating the story. I assume that these are extreme of cases. जो freaky जैसे आपने word use किया था. That's what I assume.
I mean, Hindi film industry, anything is possible. But
बहुत सारे लोग नाराज हो जाएंगे इसमें.
But so I told you there are freaky cases that science doesn't have an explanation for.
Michael Schumacher, sir, he regained his consciousness or something. I'm very unsure. I didn't follow it.
I'm not aware because I think it's a very closely guarded situation. So nobody really knows what, but he's alive and he's been taken care of by his family, and they've set up a ICU-like situation for him at home. But I don't know what the exact clinical condition is right now.
ये जंक्शन में बस आप सभी लोग को मैं एक चीज़ आई जस्ट वांट टू शेयर. सर स्पोक अबाउट ब्रेन डेथ. Remember, all of you who are watching this podcast, please register yourself as organ donors, because even if a person is brain dead, you can still save up to 8 lives. Okay, obviously every state will have its own rules, regulations, but please, it's a request on my part, and this is the reality of organ donation, cadaveric organ donation, कि हमें एक brain death की ज़रूरत है ताकि एटलीस्ट 8 लोग और जिए. You know, this is how it works out, and this was wonderfully explained by Dr. Mazda Turel. So from the brain now, let's go to the other spectrum of your specialty, the spine. I notice you've got a smile on your face. You know, I believe कि Mumbai roads is like a paradise for spine surgeons. Would you agree?
It's a paradise for spine surgeons, but horrible for spine surgeons traveling on those roads.
So you just have to sit in the OPD ना. आप एक जगह बैठो और पूरा मुंबई आपके पास आ जाएगा.
Yeah, currently it's very bad.
Yeah.
And a lot of accelerated wear and tear happening because of the potholes, because of now the rains with the potholes.
Yeah, and the construction
And
with the rains
construction.
and the potholes.
So people are taking a toll on their entire system, not only the back, the neck also, because everybody is on the phone in their car. So that's, I mean, it is what it is. You have to...
You know, probably obviously the condition of the road and construction and all of that, it's not in your and my hand. I mean, we can't do anything about it. But what message would you give? What precautions should a layperson take to protect your spine, despite the potholes, despite the construction?
I mean, most spine pain comes from weak muscles. If you understand that,
okay,
it doesn't come from the bone, joint, ligament, nerves. They may contribute to it because pain is multifactorial, but most pain comes from poor muscle tone, weak strength in the muscles, and resulting in a bad posture. So if you're able to strengthen the muscles of your core, and most people don't have an understanding of what the core is. The core is not only the front and the back, but it's also the side. You have to think of your spinal core as a barrel. So it's got front, back, sides, top and bottom.
Okay.
So you have to strengthen the pelvic floor muscles, you have to strengthen the chest wall muscles, you have to strengthen the side muscles, the front and the back muscles.
Okay.
All of those things, you need to spend about 10-15 minutes of regular back strengthening exercises every day if you have any kind of backache.
Okay. But then I'm usually on the back foot when someone on the podcast starts talking about exercising and, you know, muscles and dieting and all of that. मैं थोड़ा back foot पे, so I'm going to quickly change the topic. Let's go to slipped disc. You know, this is a very common topic. A lot of gym goers especially, you know, are very worried about slipped disc. Now, what do you mean by a slipped disc?
So it's a nice little colloquial term used to describe a disc which is the shock absorber of the spine, which is present between two vertebral bodies. It has a place. Now when it moves from its place, it's called a slipped disc.
Okay.
When it moves from its place, it pinches upon the nerve that usually goes down into the leg, which we term as sciatica.
Got it.
So when a disc moves from its original place because of whatever reason and presses against a nerve, it's called as sciatica, and that is what people typically call as slipped disc.
So it's like quite literal. The disc has slipped.
The disc has slipped or popped out or come out.
अभी सर देखो spine आपका यहाँ से लेके it's right, you know, from cervical से लेके coccyx तक. What is the most common disc which slips?
In the lumbar spine, it's usually L4-5.
Okay.
Between L4 and L5 and L5 and S1.
Okay. And what are the reasons कि क्यों होता है slip disc?
It's the most mobile segment primarily.
Okay.
But reasons are varied. Again, comes from poor posture, weak muscles.
Okay.
If you've sometimes lifted something abnormally, like lifting a bag from the conveyor belt, if you lift, make a movement that is unnatural to the body. Sometimes it's so strange that people even just get it while waking up from the bed. If they wake up in a posture that's not in tune with the rest of their body, or they've slept in a bad posture through the night, and then they wake up, something just gives. And it's usually when it gives at the time, but obviously the wear and tear has taken place long before for allowing it to open up at that area and come out.
Okay. Lekin sir, people are really confused with slip disc in one aspect because they get varied opinions from different specialists. And the main question on everyone's mind is, should we operate or should we not operate? It's a very simple question, but how will you, when will you, for example, operate a slip disc?
So there is something that's non-negotiable in the sense that if a slip disc is associated with a neurological dysfunction, let's say if a person has a foot drop or a weakness of the foot,
okay,
or he has something called as a cauda equina syndrome, wherein which you have a weakness of the legs associated with problems passing urine or stool, and a severe numbness in the area of the groin or in the legs, that means that the nerve is already damaged. So that there is no question that surgery is an emergency.
Got it.
Forget even waiting for it. Because if you operate within 12 to 24 hours, there's a chance that you may be able to reverse that function. But the ambiguity arises and the confusion is when the only symptom is pain. So pain can be managed by multiple modalities. Pain can be managed with medication. Pain can be managed with physiotherapy. Pain can be managed with an injection. Pain can be managed with ultrasound. Pain can be managed with the cryotherapy. So if you are able, even if you have a sizable disc, you give the patient about, let's say, 6 to 8 weeks.
Got it.
And 80% of people get better. However, there are some people who might say, listen, boss, I can't live with this pain. I don't want to wait for two months. I'm okay with getting surgery if it's going to give me an instant relief of pain.
Okay.
So in those kind of patients who upfront are willing to have surgery, then you could offer them the option, but with the full declaration that there's an 80% chance that you'll get better nonetheless, or 90% chance. In some cases, 95% chance. Again, it depends on the size of the disc. It depends on the location of the disc, whether it's central, paracentral, very lateral. So those are all technical things. But if you were to just tell a lay person, I would say in my personal experience, 90 to 95% of slip discs get better with medication and physiotherapy over a period of 4 to 6 weeks.
Got it.
As simple as that. There'll always be outliers. There'll always be people who'll get better much faster. There'll always be people who'll take more time to get better. And the remaining 2 to 5% will require surgery, whatever said and done.
Got it.
But it's a very small number that actually need an operation.
So this message that sir is obviously mentioning about the neurological deficit, that's a very important obviously
Yeah,
message.
so that you can't neglect.
Negotiate or
That's
So because you have used the term neurological deficit, I mean, let me ask you about a very, I should not use the word, but a very famous neurological disease, which is Parkinson's disease.
yes.
I had a very close family member who unfortunately suffered from Parkinson's disease. So I've got a personal interest in this disease. Why does this happen?
So Parkinson's is a degenerative disease of the brain, which usually occurs due to depletion of a substance called dopamine, which is one of the neurotransmitters in the brain.
Okay.
As we age, for whatever reason unknown to us, that dopamine gets depleted. And when it gets depleted, most patients start having symptoms of Parkinson's, which include slowness of movements, tightness of the limbs. Sometimes you have a tremor in the hand. The speech becomes a little slow. The face becomes a little less expressive, and they call it a mask-like face. Walking becomes a little difficult. Patients tend to fall often. So those are all the symptoms of that particular condition.
But would you say that all cases of Parkinson's are hereditary?
No.
No.
Almost all cases are actually not hereditary.
Okay.
The hereditary nature of Parkinson's is in the range of about, I think, 5% or so.
Okay.
But 95% are sporadic. So there's no way to know that you're going to get it.
Sir, in my case, I mean, I completely agree because my family member was on dopamine, and there's
Yes.
obviously a combination of dopamine so that it reaches the
Correct.
brain. I mean, I don't want to dwell too much into probably the medical management. I'm really interested in two things. Beach mein I read about this in some article or something that you had this sort of like a magnetic glove. Jaise aapne bola, these patients have got this one hand sort of a tremor. It's almost like a paisa gin rahe,
Yeah.
money counting sort of a tremor. But you had this glove, something like a magnetic glove or something which these patients wear, and it controls the tremor. So is this true?
That's usually true for a disease called as essential tremor.
Okay.
Essential tremor is a hereditary disease often seen in families
Got it.
where patients have, young adults mostly, it starts at 30, 40 years of age, sometimes even younger,
Okay.
where they have a tremor in their hand. It's not very disruptive, but sometimes it can get disruptive. And the surprising thing about that tremor is that if you want to diagnose it correctly, you ask them to drink a little alcohol and the tremor goes away.
Dekho. See, everyone's
So-
happy, huh? Dekho.
So, but I remember telling one patient to try that, and he says कि tremor इतना होता है कि अल्कोहल का ग्लास ही नहीं पकड़
See, that
पाता
means
हूँ.
उसने self try किया है मतलब.
So-
चलो अच्छा है, good.
But that's usually reserved for essential tremor. I don't know if it works for Parkinson's.
Okay, I just read that. That's why I just
Yeah.
thought I'll ask you. The second thing, I'm really fascinated by this. In a lot of hospitals now suddenly you've got these movement disorder clinics and all, जो सब जगह base हो रहे. उसमें sir, there is this concept known as DBS, which is like, I only know the full form, deep brain stimulation. I want to ask you, what is DBS?
So it's a surgery
Okay.
wherein which you drill a couple of holes into the head and then
Okay.
place electrodes deep inside the brain. So that's deep brain.
Wow. Okay.
And you connect those electrodes to a battery which is tunneled into the chest
Okay.
and can be programmed with a computer from outside. And that stimulates a certain nucleus in the brain. And that reduces or subsides the symptoms of Parkinson's. Primarily helps with tremor.
Okay.
So patients who have a horrible tremor can completely go back to doing stuff on their own without that tremor. DBS is primarily used for Parkinson's, but now the scope of DBS is expanded for conditions like obsessive compulsive disorder,
Oh, psychological. Okay.
even depression,
Wow.
even certain manic episodes, bipolar disorder. So they're really expanding the horizon because they're identifying newer and newer neural substrates
Okay.
that may be directly attributed to those conditions.
Okay.
And when stimulated, it can be controlled.
Wow. Okay.
So similarly, when you spoke about that guy playing the violin,
Yeah.
that person might have a problem playing a particular chord on the violin,
Okay.
and you might be able to stimulate a particular nucleus of the brain that might be able to undo that.
Got it. That's too complicated. But I mean, obviously, it's a very simple and lucid explanation जो आपने दिया. But I mean, see, again, I want to very practically ask you. Suppose I want to go for dinner or something from here. What will I do? I'll use a Google Map. एक नया जगह मुझे जाना है, Google Map करना है. Now you mentioned you drill holes and you have to particularly go in that nuclei or
Yes.
whatever that area जहाँ पे आप जाके stimulate करते हो. How do you do this? How do you navigate your way?
So we have a navigation system in the operation theatre. We have
Okay.
a full-fledged navigation system that allows you have to first do a CT scan and MRI of a patient, load it onto that navigation system,
Okay.
then register that system with a particular fixed position of that patient, and then wherever you touch the patient, it will show you where exactly you are touching. So
Wow,
you touch the
okay.
patient's nose, it will show you that you're touching the nose. You touch the eye, it'll show you touching the. So similarly, that's the way you go inside the brain, and wherever you are within the structure of the brain, you will know exactly
Wow.
with less than 1 millimeter accuracy that this is where you are.
Wow. और आपने जो बोला कि वो इलेक्ट्रोड जो आप डालते हो then it's connected to a monitor and also normally how long does this procedure last?
The procedure is a lengthy procedure because a lot of technicalities are involved and it can last up to 6-8 hours.
Wow.
The whole thing of getting the scan done initially, then programming everything, placing all the electrodes. So it's Not a small, simple thing.
But then you must be seeing instant results, no?
Instant results.
Instant results. Well, that must be gratifying.
Instant
Okay.
results, yeah. The moment you switch it on, tremor goes.
Wow. And even the patient will be like,
It's fascinating. You should see people cry with joy. It's unbelievable.
Wow. Any cases that you've recently done you'd like to share with us?
So now we have a team, and we've dedicated a special person in our team who does these cases. So, but they're very, very fascinating, and you can really see patients' lives completely getting transformed. The important thing is that you have to choose the correct patient. Not every patient is a candidate for. Not every Parkinson's patient is a candidate for deep brain stimulation, because Parkinson's itself comes with a big spectrum of diseases.
Okay.
It's not one thing. And so if the symptoms don't match your selection criteria and you do it, you won't get a good result. So selecting a patient for any surgery, forget this, any surgery is the key of getting a good outcome.
Which is why I believe you need a big team, You want everyone to actually start seeing multiple eyes on a patient.
Correct.
Okay, got it. Sir, I would like to again ask two things. I mean, in your explanation you did, but I wanted to have a separate session on this. The first is aneurysm. You mentioned the word aneurysm, breaking and someone having a really bad headache and all. What is an aneurysm?
An aneurysm is an abnormal outpouching of a blood vessel because of weakening of its wall. So if this is a blood vessel, it's normally straight. If it develops a bleb on it, for any reason that the wall becomes weak, that thin part of the wall of the vessel is prone to rupture because it's not as strong as the rest of the vessel.
Okay.
So when that bleb forms, it's called an aneurysm.
Got it.
And then when it ruptures, it's called a ruptured aneurysm. And then it's like an atom bomb bursting inside the brain.
But I'm assuming that you're talking about brain blood vessels.
Yeah, but you can have an aneurysm in any blood vessel of the. You can have an aneurysm in your aorta. You can have an aneurysm in your pulmonary artery. You can have an aneurysm in the renal vessels. Any vessel of the brain that is prone to becoming weak for whatever reason. Can have an aneurysm.
Yeah, I was about to ask you. You said the wall becomes weak. No, why does it become weak?
So sometimes it's just congenital deficiency. Sometimes usually in the brain it happens at bifurcation areas where blood flows and hits against the wall. Sometimes it is common in people who smoke, people who have accelerated hypertension, cholesterol. So all those things that can damage the inner layers of the artery can cause weakening of the vessel wall.
How will a person know that he or she has got an aneurysm?
No way to know unless you do an MRI. MRI with an MR angio. We don't have a screen. In certain countries like Japan, where the incidence of aneurysms is extremely high, they have a national program where they just screen everybody. And those who have an aneurysm and they fit into certain criteria, they're just selectively treated for an aneurysm before it ruptures.
Okay.
But in our country, I don't think it's possible to do that.
But then what is the incidence of this in our country? Are there some
I don't know the exact stats, but it's not very high.
Okay. So you can get away with not screening or something because it's not so high.
Don't screen, yeah.
Okay. And suppose once you do diagnose a person with an aneurysm, is it 100% कि आपको operate करना ही है?
No.
Or you observe?
So again, depends on the size of the aneurysm, depends on the location of the aneurysm, depends on whether the patient has had symptoms related to the aneurysm. All of those things will determine whether you need to treat it or you can let it be.
Okay.
A large portion of them require treatment. A small portion of them can be let alone.
Got it. Okay. So the last segment, which, I want to talk to you about before we go into our WhatsApp Gyan session is it's about brain cancer. Brain tumors or cancer. You obviously did mention about that.
That's what I deal with the most.
Okay.
And it's closest to my heart.
So how many cases on an average do you see in a month or something? I'm talking about brain tumors.
Yeah, we operate about 15-20 brain tumors a month.
That's a huge number.
Yeah.
It's almost, every 2 days you're operating in one case. Okay. Wow. So, but in India, are you seeing some shift in the incidence of brain? I mean, I'll give you an example. For example, in lung cancer, what we are seeing is that the number of patients who come to us have now suddenly become younger. At one point of time, we used to get patients in their 70s or late 60s, up to 40s early 50s, maybe you're getting advanced lung cancer.
Yeah.
We're also seeing कि lung cancer females में बहुत ज़्यादा हो रहा है compared to males. ऐसा we are seeing some shift. Would you say the same also in brain
all
tumors?
the cancers of the body are now being identified and diagnosed at least a decade earlier than what it was half a century ago.
Okay.
All. There's no exception to the brain.
And now for example in lung we've got smoking, we've got occupational exposure, pollution. So we've got these evident causes. Brain cancer में आप क्या बोलोगे sir? What is the cause?
Nothing. There's nothing consistently identifiable. It's just a sporadic genetic mutation. I could be having one sitting here while I'm talking to you and I don't know about it.
That's very
It's scary.
It's scary, exactly.
Yeah.
And again, how do these patients present?
So most often they present related to neurological dysfunction, or they could have a seizure,
Okay.
which is an epileptic attack, or they just have headaches that don't go away, or they have headaches with raised intracranial pressure where they have headache with vomiting, double vision, weakness of some hand or leg. Sometimes hearing may be a problem if the tumor is associated with the hearing nerve. Sometimes if the tumor is pressing against the eye nerve, vision may be compromised.
Okay.
Depending on the location and depending on what neural substrate it affects, that's the symptom that you might get.
I think इसके लिए you were in between. You were saying that if you've got a headache, no apparent cause, 2 weeks, just get an MRI done.
Yeah.
Okay.
It's
Perfect.
better to be safe than sorry.
And अगर एक patient को हो गया brain cancer, what is the average survival?
So again, brain cancer is great. So 50% of brain tumors are cancer, 50% of brain tumors are not cancer.
Okay.
So that's good. The benign tumors are good to have. A lot of the times you can remove them completely and you can get a full cure and a normal life.
Okay.
Now in the 50% that are cancers, they again range from grade 1, 2, 3, 4.
Okay.
So grade 4 is the worst. And that usually has a life expectancy of anywhere between 1 to 2 years. Grade 2 has a life expectancy of 12 to 15 years and grade 3 has a life expectancy about 5 to 7 years.
Still,
Again,
I
it
think
varies depending on, now even the molecular grading is changing. Now there's no such thing as a grade, there is a thing as grade 1, 2, 3, 4, but again, your grade 4 may be completely different from someone else's grade 4, maybe completely different from someone else's. It just depends on the fingerprinting of the cancer that they have.
But I think the bottom line message is obviously if you've got some unexplained neurological symptom or a headache or something, I think it's better to get investigated and evaluated as soon as possible.
I would strongly recommend that. Yeah. Even like elderly people who tend to forget stuff, who have behavioral issues, who are often treated as, being psychiatric or having psychological problems and started on anti-anxiety medication for depression, etc. So many of them actually have brain tumors.
Wow.
And they're for 3 months, 6 months, they're given medication, nothing really changes. Then someone says, oh, let's do a scan and see, and they end up In fact, just 2 days ago, I operated on a 70-year-old lady, and all she had was a little bit of confusion for the last 3 months. And that just kept getting worse. Initially, she was managed with a psychiatrist. And then actually the psychiatrist had the astuteness to get a scan done because he said something's not fitting. This is not a simple forgetfulness or not a simple confusion. She's not behaving the way she should be behaving. Get a scan done. Showed a large tumor in the frontal lobe pressing against the frontal lobe. Removed it. Symptoms resolved.
Wow. I mean, God bless a psychiatrist, obviously.
So it's great.
He or she had the astuteness.
Great that people are insisting now to get a scan done.
Okay.
And I think that's key.
Dr. Mazda, thank you so much. Yeah, we really had a very intense, session. Neurosurgery obviously is not a child's play. It's a very intense branch as compared to pulmonology. We have more fun. But
neurosurgery has the maximum fun, boss.
Really? Achha,
we can tweak people's brains. What more fun can you
that's also true. That's also
have
true.
than that?
सर मेरे पॉडकास्ट में ना एक सेशन में ऐसे एक रखता हूँ. आई जस्ट कॉल इट द व्हाट्सएप ज्ञान सेशन बिकॉज आजकल ज्ञान इज ज्ञान हैज ऑलवेज बीन फ्री एंड व्हाट्सएप जब से आया तब से द रेट एट विच इट ट्रैवल्स इज ऑल्सो रियली very quick. So a lot of people have got a lot of statements to make, some sort of suggestions and all of that. So It's a very fun session, a very light-hearted session. So I would just like to put some questions or something to you, and let's see what's your response. Okay. So the first statement is Neuralink. Elon Musk has come out with Neuralink. It is dangerous. So if you could just tell what is Neuralink and your opinion.
I mean, Neuralink is a computer-brain interface that allows an external modality to help the brain recover any dysfunction that it had.
Okay.
So if a blind person can't see, it'll help you see. If a paralyzed limb is not able to move, it'll help you move. The danger is only people are talking about it is whether are you going to misuse it to become smarter? Are you going to misuse it to become more intelligent, to enhance your performance in whatever field you're trying to excel in?
But Elon Musk ने Terminator movie नहीं देखा? What if the AI controls you? What if we are headed to a really man versus machine war? What if Terminator was true?
I mean, eventually it will become that way, na?
I know.
We will have to find some kind of balance to see where we can. Any technology, for that matter, has its pros and cons, and you have to be wise enough to make it your slave rather than your master.
Oh, that's a nice statement. Make it a slave rather than master. Okay, perfect. Next question जो है ये statement बड़ा अजीब सा है. Are dreams a way of telling us a message? We've got a lot of Sigmund Freuds in our society. So
Wet dreams or regular dreams?
regular dreams ये वाले, but you can take it in both sense.
No. I mean, these are all again esoteric questions, man. Nobody knows the answer to this.
Okay.
Everybody will have a different explanation, but I guess there must be some power of the subconscious mind
Okay.
that we have not understood. And I'm sure there are people who understand stuff like this. I'm not one of them. You can decode, decipher whatever you dream may have a very, very strong implication in your life. And sometimes people wake up in the middle of the night, write their dreams down or whatever thought they have. I mean, so there is definite science to it. It's just, I don't know much about it.
But अभी जैसे आपने बोला कि some people might have tapped into their subconscious and they
Yes,
do this.
of course.
The next question is really very funny. Preachers / saints / rishi munis have a higher mental functional capacity.
I'm guessing 100% if the genuine ones.
Okay.
See, we have not tapped the potential of the human mind, right? So if the Neuralink is happening, is being made available for the common man, but I'm sure if you are able to harness the full potential of your mind, a blind person can see, a paralyzed limb can move, you can be physically present at multiple places. You can astral project yourself. You can have some kind of telepathic communication with somebody else in another continent. In all those things, there are people who say that actually all these things happened several centuries ago and got lost somewhere along the way. And now people are becoming aware of it, so it's now like one whole hoo-ha situation. But I mean, I just go to work, open up a brain, and come back home, and I'm happy. I don't need to really delve into.
My next question, it's very funny that you already mentioned it. It's about astral projection is possible. Now, I'll give you the backdrop. I'm a huge horror movie fan. आपने Insidious movie देखा है? So Insidious movie is all about astral projection. Okay, obviously it's a horror film. After that, I actually Googled it out. And apparently on Google, they tell you steps on how to astral project, which I found really weird. Now, you are obviously an expert. Have you come across patients who, not doing astral projection, but come across patients who have experienced this?
When you say what your soul leaves your body.
Yeah, and the soul can see your body, and your soul can actually travel and then after some time comes back.
But there are enough people around us whose souls have left their
Not
bodies.
permanently.
Not permanently while they're alive. But no, I don't know any such person. But there have been accounts of there was a neurosurgeon who has written a book. I don't know. I think his name is Ebenezer. The book is called Proof of Heaven. where he sustained a fulminant infection and his soul left his body. He traveled to some place far away, but he could see and hear every single thing that was happening to him in the ICU for 21 odd days. And when soul came back, where soul left the body, went to some white land far away. And when he came back, he regained consciousness. He wrote a book about it.
Wow.
It's called The Proof of Heaven. And he was able to narrate every single conversation that people had at his bedside, all the fun they made about him, all the hope that was given up. Everything was, and he wrote about all this and then counter-checked it with the hospital people. Wow. So 100% there is some stuff. It's just that you're asking the wrong person about it.
Proof, but this is the biggest
yeah,
proof.
So I mean,
this author is the biggest
the
proof.
author is the. I have no personal
okay.
Experience of any of these things, but 100% all these things exist.
But my love for Insidious, I'll definitely get this book now. So next question, it's a very good question. Does meditation improve cerebral function?
There's no doubt about it. Okay. Now, once upon a time, that's why you said, our Rishi Munis are definitely at a higher plane than me and you, because they did all of this stuff. And now we have enough evidence, scientific evidence. Till now, nobody believed that meditation helped. But now you have scientific evidence that shows that meditation increases the cortical thickness, it increases the blood flow to the brain, it increases, enhances certain cognitive areas of the brain. So there's scientific evidence now to show that it's beneficial.
Okay, wow. So meditation does improve cerebral functions, as you've mentioned.
Maharishi Mahesh Yogi, his team who started with transcendental meditation, these guys also did a lot of scientific stuff to talk about it. Deepak Chopra, I believe, also is scientific in his approach to whatever he does. So there are many people who might be able to give you more accurate answers than me as far as these things are concerned.
But then it does have a positive impact, which is the perfect thing.
There's no doubt.
How much of the brain has actually man understood?
Very little.
Okay.
Negligible.
Okay. So I think the person who understands it more will be a genius. Something like that? Wow.
Of course. I mean, they say, now I don't know who the they is, but they say that the capacity of the human brain is about 2.5 petabytes. Have you heard of a petabyte?
No,
Never.
It's the first time. Yeah.
A petabyte is a couple of million gigabytes.
Oh.
Imagine.
We're still
How
at
much
negligible level.
We are at we are like that, dot in all the galaxies across the world.
Correct.
That kind of situation.
Okay. And my last question to you is going to be a quick sort of a rapid fire choice. Okay. So what would you prefer? Operating on the brain or operating on the spine?
Brain.
And you can give an explanation also. Why are you neglecting the spine? Come on.
Spine
Mumbai
is
roads,
great.
Come on.
Spine is great. It gives you immediate, very good, gratifying results. But the finesse that you need in operating on the brain, the texture of the brain, the way the brain looks under the microscope.
Oh, wow. Neurosurgery or daily columns?
Neurosurgery, because that's where the fodder for the daily column comes from.
Okay, 8 hours sleep or meditation?
8 hours sleep.
8 hours sleep.
I can't.
Okay.
My work is my meditation, so I'd rather catch up on some sleep.
Arey wah, lovely answer. Making Instagram reels or detox with Dr. Kapil?
Detox with Dr. Kapil.
That's the answer. Yay, मैं इसके लिए रुका था. Okay, so last question before I wrap things up. Choose your words very carefully, Dr. Mazda. 3 things that I should improve on my podcast. देखा कोई जवाब ही नहीं है. That's it. Wrap up.
It's great. No, I had a great time.
Okay. Chalo, thank you so much.
Thank you.
It was really a pleasure to have you. We know you've taken time out from your busy schedule. You've traveled all the way to the other part of town. I still say this is town. So thank you so much.
Get a visa a couple of meters away from here.
Done. But nevertheless, thank you so much.
My pleasure. Great having you.
Yeah. उफ यार, मैंने तो इंट्रोडक्शन में आप लोग को बता ही दिया था कि ही इज़ द मैक ड्रीमी ऑफ मुंबई, एंड आई थिंक टुडे ये पॉडकास्ट के जरिए ही हैज़ एक्चुअली प्रूवन दिस, यू नो. It was so lovely to interact with Dr. Mazda Turel. Lovely sense of humor, in-depth knowledge about, you know, the brain, neurosurgery, spinal cord. So many simple day-to-day questions जो मेरे मन में था, which I got cleared. And, you know, he gave a precise, concise, to the point explanation and answer. It was a treat to watch. एंड ये एपिसोड के बाद मुझे आप लोगों को ये एक चीज़ बताना है कि धीरे धीरे मेरे चैनल में जो है व्यूज़ जो है, आप लोग के सवाल जो है, आप लोग के रिस्पॉन्स जो है, आप लोग का प्यार जो है, ये ऑफकोर्स बढ़ते जा रहा है. आई एम सो हैप्पी, आई एम सो ग्रेटफुल टू ऑल ऑफ यॉल. प्लीज़ ये प्यार आप कंटिन्यू करते रहिए. एंड ऑब्वियसली यार, मैं मना तो नहीं करूँगा, थोड़ा प्यार अगर बढ़ गया तो ऑब्वियसली मेरे लिए अच्छा है. बट यू नो, प्लीज़ कीप वॉचिंग, keep subscribing, keep sending me questions about whatever topics you guys want to know, you guys want to have a simplified explanation for. Please आप ये सब लिखते रहिए. You know my channel of communication is always open. Please support me. DTalks with Dr. Kapil. Thank you.